Hi guys, so for my corona simulation, I had patient initials MD. He is 64 years old and 161 pounds. He has hypertension and type 2 diabetes, and he takes one pill for both of those. He gets a stomach ache when he takes ibuprofen, and he came in today because the last 2 days he's had a fever and a dry cough. The cough has lasted about a week and it has no improvement. He has tachypnea, and he's been tired lately and having a hard time breathing. I asked him to rate his pain, and it was a 0 out of 10, no pain. He hasn't been very hungry lately, and just from him laying there in bed, he seemed very agitated. He hasn't traveled anywhere lately, but his next door neighbor, got tested positive for coronavirus, but he said he hasn't seen him for a few days. He's a retired worker, and he used to smoke when he was younger, but he stopped. And then when I took his vitals, his blood pressure was 162/77. His heart rate was 97, and his respiratory rate was 28, and oxygen saturation was 93%. His temperature was 100 degrees Fahrenheit, and his glucose was 122 milligrams. When I listened to the respiratory system, I heard a fast wheezing sound throughout all lung fields anteriorly, and then when I assessed cardiac for cap refill time, on his fingers, I got 1.3 seconds equal bilaterally, which is good, less than 3 seconds, expected finding. For his carotid pulses, they were strong, +3 equal bilaterally. For his radial pulses, they were strong, +3 equal bilaterally, and then his popliteal pulses were strong, +3 equal bilaterally, and then his femoral pulses were +3 strong, equal bilaterally, and dorsalis pedis pulses were +3 equal bilaterally too. When I assessed neuro, the Glasgow Coma Scale, he scored a 15, which means he doesn't have an impaired level of consciousness. Some of the interventions I did was I encouraged coughing, I took secretions on him, and then I elevated his bed to 45 degrees supine, and that helped him with breathing, and then the inhalotherapy, which helped with his cough. And then some of the tests I ordered for him was a complete blood count, and then some of the stuff that came back abnormal was his lymphocyte level was 530, and then his platelet level was 127, and I did a nasal swab for coronavirus, but it came back that nothing was detected. And then I did a urinalysis, and it was 3,504 milliliters, which is high. And then at the end of it, the diagnosis, I was correct, and it was a risk of infection by the coronavirus disease. And some of the meds that I could have used was acetaminophen. That was a second priority for him, and that's it.